या वीडियो भी बनेगा या तो इंदु जी आप अपने आप को अनम्यूट कर लें प्लीज। इंदु जायसवाल जी। इंदु जायसवाल जी आप अनम्यूट कर लें फिर यू कैन स्टार्ट। नो यू आर स्टिल म्यूटेड, यू आर म्यूटेड। अनम्यूट कर लीजिए अपने आप। We got Bobby ji also, so that's good. We can start. Bobby जी आप अपने आप को अनम्यूट कर लें प्लीज।
Thank you.
मैं इंदु जी आप भी कर लें अपने आप को अनम्यूट, आप अभी तक म्यूटेड हैं।
मेरे को ना थोड़ा सा ये स्क्रीन।
Oh, you are fine. We can see you, Indu ji.
Okay, okay, you can see me.
Yeah.
Okay, I think yeah, now I got the screen.
तो हमारे बॉबी जी आ गए हैं, डॉक्टर बॉबी कुमार कलोटे जी, जिन्होंने आज का ये प्रोग्राम अरेंज किया है मिलके सबके साथ। तो बॉबी जी ऑल योर्स प्लीज।
Good evening to everyone. And congratulations to all the doctors, not only just one on the screen, around the world. You know, a couple days ago, be precise, on March 17, I had my birthday and some of the judges took me out for lunch. When I say some of them, they was close to 60, 70, if not more. And some people say, why you're so much friend to the judges? If you, God forbid, ever need them, they cannot help you because they will recuse themselves because they're your friends. But I'm going to share with you, I share with those judges that day. And I use a doctors as an example that when COVID hit, we all start saying thank you to the doctors, thank you to the first responder, thank you to the staff. But once the COVID coming down, and then we're going to slowly going to forget. And my purpose of that statement was how we always say thank you to our army, thank you to our law enforcement. And I felt why it's only one day, why only when we are in the middle of the crisis, but not appreciate them every day. So I use the doctors as an example. They fight the battle so we can live better and healthier every day for us. Why we don't every day when we see our doctor or we see our friend or see somebody and tell them thank you. And I'm going to say myself today, but not just only today, but every day, a thank you, what you do. I see Dr. Bhupi Patel on the line. I see Dr. Vijay Shah. I see Indu. I see Nutanji. I see some others I cannot see, but I see Dr. Manchu Pandya. Dr. Manchu Pandya, you can get online, okay? You are handsome. You don't have to hide yourself behind the video. When we went to our missions, they done a fantastic job. I remember clearly. When Dr. Uppal and Dr. Bhupi Patel and Dr. Kumar said, we made plenty money, we saw so many patients, this maybe was the most satisfying trip that we was able to help so many people. And they were so gracious, they were so kind, even though there was a patient, they were so thankful. And I think it's appropriate, we should have learned the lesson, I say to myself, that day from those patients. So why shouldn't we say to all our doctors, thank you every day, but when come to a special day, we should never forget. So I'm not going to take too much time because otherwise Indu going to tell me what happened to her time. So I will come back right now. All I'm going to say is I'm just honored and privileged to join you, wish you a congratulation, wish you a genuine thanks from the bottom of our heart, not just lip service. If it's a Jagmohan Kalra, if it's Dr. Bhavani Srinivasan, no matter who it is. And Bina ji, you are a leader. Just remember, we must every day not forget to say thank you to our law enforcement. In the same time, what is just what the law enforcement do? They protect us and they make sure we enjoy our life. But I believe the doctors, nurses, and staffs, they protect us much more, a longer, every day, the enemy of any disease, not only one kind. And they say, when you don't have a good health, you have nothing, no matter how much money you have. If somebody stole your wealth, it's not going to affect because you can make it again. But if somebody steals your health, you will never be able to make it. And I am just humble to join, and I did not want it to miss without joining and congratulating all the doctors. All the doctors. One more statement I will make, if I have your permission. Once, over 20 years ago, my nephew got sick. We brought him here, and he was 13. He had a cancer, but he died. But I still remember that day. Dr. Bhupi Patel and myself went together to see him. And he have 5 top doctors, including Dr. Noori, in that room. And Dr. Bhupi said to me and to my sister-in-law, you know, to get one of these doctors is difficult. You have 5 of them standing here, and we are privileged to serve. And Bhupi, I don't forget, even though I'm getting old, 21 years later, I remember, I thank you, my friend Dr. Arvind Shah, who is no longer with us in a physical but in a spirit. When we went to the trip in El Salvador and other places, you guys made so easy for me to make that trip successful. Except Indu's husband, he went playing golf. No, just kidding. Everybody's helped. So today is your day. Congratulations to all of you. And Jyoti, I just want to read. I hope I received them sooner. We had made a plaque for them. I don't have it right now with me. I told them to send to you. And the plaque will read, Friends for Good Health, Indian American Forum, and Indian Association Long Island proudly present a New York Community Kindness Service Award to, so I'm going to use one name, so it will be every doctor will be received the same, to Dr. Bhupendra Patel for your exemplary services in the field of medicine, outstanding leadership, dedication, and honest hard work for helping our community in the pandemic time for the last 2 years and continue. Thank you. March 30, 2022, and is signed by our wonderful, hard-working, loving, caring, sometime nice Indu Jaiswal from Indian American Firm, Friends for Good Health is Bayalata Dusha, and from Indian Association of Long Island, our wonderful newly elected President Bina sabapathy. Congratulations, God bless, and I stop.
Okay, thank you, Bobby ji, for those welcome remarks, and thank you for getting those plaques made. I know everybody will say ek aur plaque se kya farak padta hai, but it's very important. So this morning I was talking to Bobby ji, and I said, Bobby ji, today is National Doctors Day. He says, okay, we'll do a call. I said, okay, let's get on it. Like within no second, okay, let's do it on a Zoom call. We need to appreciate all our doctors. It's a Doctors Day, National Doctors Day. I'm in healthcare too. I work with doctors all the time. Like Bobby just said, how hard they work. It's always very easy for us to say okay, the doctor is not good or a doctor did not do this or let's get another opinion. But if you work with them every day and if you see how hard they work, and not only that, nowadays, the kind of, criticism they get from their patients, which was never there before. The patients also, they have too many questions. They have too many, input in their care. And sometimes they also drive doctors crazy, but doctors, that's what they are. I mean, they are so smart and they know how to handle their patients. And, it's important. We all want to, like I said, Jagji's background, health is wealth. Absolutely. My words were during COVID time. I said, COVID has taught us one thing. If you don't have your health, all your millions of dollars mean nothing. All of us lost our family members, rich, poor, old, young. We all are in the same boat. And all of us felt the same pain. At the same time, we were going to work. We were working with the patients, but not as directly as the doctors. Believe me, they had to wear those, those white suits and with those masks and double mask and then I-95 mask and a shield and the gloves. It looks nice on the picture on the screen, but if you picture yourself, you're in that, gear, protection gear for the whole day, how will you feel? So, the credit goes to the healthcare professionals, doctors, especially in ICU, when they work with the patients, and their goal is to save lives. The doctors are, like I said, they are gods, and they are the ones who save our lives. And we want to salute them. We want to thank them. And we want to always appreciate what they do, no matter which part of the world they are in. We are always happy to have good doctors around, and we want them to continue to serve the community. Thank you. Thank you. So shall we start inviting the honorees, Jyoti ji?
Sure. Who you want to invite, I'll highlight. Yeah.
Okay, so let's start with our trustee of our Indian American Forum, Dr. Very senior, very esteemed, and a very honorable and a very humble cardiovascular specialist, pulmonary specialist, who's the chief of medicine at Mount Sinai, had a huge practice, and I can go on and on. And of course, a philanthropist with the biggest heart, our own Dr. Bhupendra Patel. Bhupi, can you please join in, say a few words?
Thank you all for inviting and honoring doctors on a Doctor's Day. And it's a very noble profession. I've been practicing for the last 50 years. And like everybody knows, when I used to go 2 o'clock in the morning to the hospital and the patient was sick, and I spent 3 hours, I came home and went back to work at 6 o'clock, 7 o'clock again. And I was the happiest doctor in my time. The day I went into the hospital and the patient died for whatever reason, he had a bad heart attack and he died, I'll come home and be very sad. So all the doctors here know one thing, it's a very noble profession. 50 years I practiced medicine, and every day I went to work, I enjoyed. And I still enjoy practice of medicine. And all the doctors here know, it's not an easy profession. Sometimes people think we go to the office, see the patient, we get up at night, think about the patient. When we are driving, we're thinking about the sick patient in the hospital. It's not an easy profession, but God gives you a privilege to be a doctor. It makes you happy serving the patients. And I enjoyed what I did for the last 50 years. I know Dr. Jagmohan Kalra is here, and she's who, we worked together in Queensland Hospital, and she's a very fine doctor, very respectable oncologist. So when you look at it, even the doctors community, we have a lot of respect for each other. And it's a very noble profession. And like Bobby said earlier on, we were in San Salvador. When we went to the morning to the mayor's office, there were 500 people waiting, for us to see. They had come from all over the place. And I still remember a lady came in and she had a little bad eye infection. And we looked for medication, wasn't there. I took out $20 from my pocket and I said, please make sure you get this drop from the pharmacy. This is not a profession which you say, okay, this is fine. But like everybody said, and I'm glad you're honoring all the doctors here, and they deserve the honor. I have a young daughter who's a doctor. She's a vascular surgeon in Concord, New Hampshire. This morning, I was thinking of sending her a note, say, Happy Doctor's Day. It's funny. While I'm thinking, I get a text from her, Happy Doctor's Day.
Yes.
So I went back and said, Happy Doctor's Day to my favorite doctor, Dr. Ray. So it just tells you, it's an interesting thing. But thank you very much. And Bobby and Induji and IALI, listen, we are a big community. Doctors are important. All of us are important. All of us do a good work. Bobby and all the group did a terrific job on the COVID-19. You saw the things. And yes, we are a great community. Let's keep up the good work, and congratulations to all the doctors. Thank you.
Thank you. Bhupa Bhai. Moving on with our, we want to actually listen from all the doctors. So I see that Dr. Usha Tandon is here. So we will, Dr. Usha Tandon is a very active, esteemed member of India Association of Long Island, psychiatrist by profession. And I see that, during COVID time, she also ran a lot of, Zoom sessions, counseling and, helping seniors, old adults. And she has been in practice for a long time too. So Dr. Tandon, congratulations. And we want to hear from you a few words.
Okay. Thank you very much for recognizing all the physicians on Doctor's Day. Actually, I've been so busy in the hospital. We had recently joint commission survey, and today when I opened up my email, it said Happy Doctor's Day, and I was kind of surprised. And Dr. Patel, at least he wished his daughter a Happy Doctor's Day. I have a daughter, a son-in-law, and son who are all physicians, and I didn't call them to wish them Happy Doctor's Day, but I will soon remedy that and will do that as soon as I finish with this. So I have to say I'm honored, and I want to thank the committee for recognizing my services in the community. And I assure all of you that I will continue to provide services and be available for all of you. In the end, I would also like to add, I know my son is an ICU doctor. He is a pulmonary critical care specialist. I did not see him for a year and a half when the COVID hit, because his statement was, you are better off where you are, and I am better off where I am. Let's not see each other. Let's just talk on the phone. In the end, I would also, it is a Doctor's Day, but my heart goes out, and I want to thank all the respiratory therapists, all the dietitians, the people who cleaned the units, who provided diet, who took care of the patients. I really want to thank them from the bottom of my heart. And as I said, I will always be available. I'm a psychiatrist. I'm an addiction specialist. Anybody who needs my help, they just have to call me. Thank you again for the committee. And I think if I have to name, it is Dr. Bobby Kalootee, Bina Sabapathy ji, Indu Jaiswal ji, and of course, our Jyoti Gupta ji. Thank you very much.
Thank you, Dr. Tandon. Bina ji, would you like to invite the next, doctor?
बीना जी आप म्यूट है, प्लीज अनम्यूट योरसेल्फ. थैंक यू.
ज्योति आपने दिया नहीं मेरे को, so इंदु जी आप कंटिन्यू करो.
But say a few words.
We can hear you now, Bina ji.
No, I said Jyoti ji आप कंटिन्यू करो. Because
Okay, Bina ji, okay. So, okay, now, of course, the next one, I'm just going to follow the flyer. Dr. Jagmohan Kalra, would you like to come in and join us? She's also known as Jagji. We know Dr. Kalra from India Association of Long Island, going back almost more than 25 years. A very well-known oncologist, a very highly acclaimed physician in Northwell, has a huge practice. She speaks very highly on women's health and on breast cancer awareness. So, Dr. Kalra, would you like to say a few words?
Yes, thank you very much, Indu ji, Bobby ji, Jyoti ji, and Bina ji for organizing this in such a short time. What a beautiful gesture for all of us. We, as a doctor, like Dr. Bhupi Patel said, I can never forget him and forgive him for giving me such a good education and training. We work together that we are friends forever. And our motto is to do our best. First, do no harm. This is what we learned. Bhupi, do you remember that? First, do no harm to a patient. Always have good intentions. And Induji said, sometimes patients get nervous or anxious. We just listen to them and kindly say, I'm doing my best and I'll do everything I can to help you. So this is feels so good that when once a year, Northwell sends me a letter like email today, Happy Doctors Day, free breakfast and lunch. I said, wow, I'm going to get a good lunch today. And my two sons are doctors and I forgot to wish them. So thank you, Usha ji, for reminding me. And thank you, all of you. All of us are here to help people. I won't say patients. I say people in our community. And we are always here. Induji call anytime. Shashi ji calls anytime. So I'm always here. And I'm very humbled and very honored. Thank you so much. Thank you.
Well, I think, with today's Zoom call, we are, we are remembering our children too. So whoever did not wish their kids, go ahead. You do still have time today.
Thank you for reminding, really. I was working too, I came out of work and I ran here to do this. I said, no, I have to be there. Thank you so much again. Thank you.
And Induji, may I introduce this young lady, Dr. Prachi Dua? And I'm going to tell you why.
Yeah.
I think I know probably her parents. I did not knew her. Another day when I saw her trying to help, she touched my heart. And not only her, when I see our young doctors who just not too long ago start the profession. Now why she touched my heart? Because she so humbly was trying to help everyone. Our crowd is not the easy crowd. We are sometimes kind of obnoxious and we forgot. But she was so kind and helping everyone and not trying to put herself in front of others. And even each time I ask her, come in and let's take a picture, I just wanted her to know that we appreciate it. That was my reason. And then she told me she's an ophthalmologist. And then I learned a little more how she goes out and try to help people in India and other places beside just her profession in America or try to make money. It is Dr. Prachi Dua you and Bhupi Patel and Kalra and the other doctors, what you guys do every day out there serving the society. You are the top, the cream of the cream. It is your work, it's your decency, it's your profession. Make me and other Indians so proud when we walk out there. And I just want you to know, and these leaders who are joined, I want every doctor to know how much we are humble of your presence, of your profession. God bless you. Continue, keep doing the good work. And the young lady, Dr. Prachidua, you yourself, congratulations to you. And continue bring the other, your colleagues and friends. Like Dr. Bhupi Patel said, the noble work that you guys do every day. So, congratulations, and mic is yours.
I just wanted to thank Induji, Bobby, and like Jyoti Andy and like for recognizing our efforts and our hard work like through the past 2 to 3 years. I think for a lot of the young physicians, like COVID was a very difficult time. Like what we saw in the hospital. I'm not going to share now. You guys are like all remember the images, but I think that there were some that questioned their profession because they weren't able to like withstand the stress, but there were some that were like really proud. And I remember that I wrote something where I said that on January 1st, like I claimed that 2020 would be the year of perfect vision. In hindsight, it actually is. We've been forced to see beyond the natural eyesight and understand beyond our unhealthy mindset. At the age of 32, I did not imagine that I would live through a pandemic in my favorite city, New York City. But I definitely know one thing: since the day I was born, God has kept his hand on me and chosen me to heal and save life. How lucky am I? I've never been so proud and so humbled to fight alongside my colleagues. And I feel so blessed to enter the hospital every day to take care of patients. And if God asks me again about what I want to be in my next life, the answer is still going to be a doctor. And may God bless all the healthcare workers who've been fighting with strength, courage, and resilience without fear. And we're going to win this battle together as a human race. And this world is going to become such a beautiful place to live in again, where feelings of love and respect is going to triumph over hatred and jealousy. So that's, I think, like life is back to normal. Like we're all in our offices, like seeing patients, like elective surgeries are happening. But I think that one of the most difficult things that we face is taking care of like uninsured patients. Being able to get them access to medicines. And I think that even within the Indian community, within Queens and pockets of Long Island, there are a lot of uninsured Indian patients. And that's why like I volunteer as much as I can whenever somebody invites me to do like to do the health fairs from like the ophthalmology perspective, because a lot of like these patients like might not even get like cataract surgery because they can't afford it, or they do not know that there are like hospitals available in Brooklyn and Queens where they could go for like cataract surgery. So I do think that like now that like COVID is kind of over and everyone's like vaccinated, that we should get back to like doing health fairs as much as we can, at least like 4 times a year, and trying to reach out to like the uninsured population. But thank you so much for recognizing the efforts.
Can I say something? Yeah.
Yeah, Jyotiji, go ahead.
Yeah, Prachi, I know when she came to New York in 1998, I know her, and she was very young, and I have seen her working so hard and reaching her goals. And her brother is doctor, her both parents are Dr. Asha Dua, Dr. Rakesh Dua, and Dr. Asha Dua is my best friend. They're such a nice family, and I'm so happy for them. And Prachi, congrats on this special day.
Thank you. Thank you.
Love
Thank you so much.
Do you see Dr. Nilesh Mehta or Sean Gupta?
Nilesh Mehta is here.
And Dr. Abhay Malhotra is there too?
Yes, he's also here.
So
I highlighted Dr. Nilesh Mehta.
Oh, okay. Okay. So we want to welcome Dr. Nilesh Mehta. So Dr. Mehta is a very well-known GI specialist in Long Island. And he has, quite a few large amount of GI physicians working with him. And of course, another bright, young, upcoming physician with a huge, group of doctors working with him. That shows his leadership, and that shows our Kanaksa is joining Dr. Nilesh Mehta. So, Dr. Mehta, we want to welcome you, and we want to hear your experience as a GI specialist. And
Induji, may I add in? Uh, I just wanted you to know,
only one line.
when we compliment someone, when you choose to honor, when I was saying about Prachi and Prachi's parents, Jyotiji was saying, I'm going to say Dr. Nilesh Mehta, he's my doctor. Actually, I'm his also patient. And not only I'm the patient, not because of Dr. Kangolia, is my friend over there, but I was so proud to be his patient. And now every time when I recommend a patient to his facilities, I usually call it a guest to his facilities, they brag about it. I send one of the major journal to his facilities. I think everybody in the Army and New York State Guard knows there is a doctor, his name is Nilesh Mehta. Not only what he did professionally, what you guys do personally to take care of your patient in such a humble way, to understand that thing what Prachi was talking about. And that's what Nilesh and Preeti do. And congratulations, so proud of you, the work you guys do, and continue keep doing, because it's make us look super good because of you. Thank you, sir.
Thank you, Bobby ji. Thank you, Jyoti ji and Indu ji, for getting this small event together. It's, we always, for some reason, have been so busy as physicians that we fail to recognize the work that all the healthcare workers and other physicians have been doing during the pandemic and all these years. So, as a special note myself, for all the doctors in my practice today, we actually got a cake and we got all the staff and we closed the office down for an hour to appreciate all the work that everybody in my office does. And that was such a nice moment for everyone. Patients may appreciate you all the time, every day. We can get good reviews online every day, but it's nothing like when your own colleagues and the people who live with and your community people who out of their own selfless love. I mean, the event that you've sponsored today, Babaji, it just touches my heart. It just kind of gives me a feeling that really your family, you care so much about us that you, even though it was a last minute thing, it just shows your affection. It just shows how much you care and value the doctors in your community. I've always respected, and I've had great advice from Dr. Bhupi Patel, from Dr. Abhay Malhotra, Dr. Pandya. I mean, they are part of my community, but when we connect with all the doctors in our community, Dr. Shah, Dr. Dua, we kind of have this feeling of camaraderie. And for some reason in the Indian community, we have so many doctors that, quote unquote, we lost the value, or we kind of feel like there's doctors all over, but we somehow undermine doctors because we see so many of them. But today I was really touched when I got a card from my office staff, and about 30 of them had all written in the same card for all the doctors in our office, such kind words that it really makes us forget everything that we've been through in the last 2 years. Everybody in the community, in the country, has recognized what doctors have been through in the pandemic, what they've done, what they've sacrificed. We've seen the sacrifice, and we've seen one of our own personal family member, a doctor, who's been through a lot and unfortunately is not with us today. It brings always tears in my heart to think about someone who spent his entire life devoted to the community, who's not with us today, unfortunately. I mean, everybody knows who I'm referring to, Dr. J. Lora.
Right.
Everybody in the Indian community knew about him, everybody in our family, and in the entire Indian community. Not just the community, everybody around has known him, respected him. And I would kind of take the time to pay my respect to him at this moment on this day, because he truly devoted his life to everybody. The other thing we always talk about is, you know, people always talk about and it being a noble profession, the work you put in, the lives you save. And nothing touches me more than when people talk about all these things. But I look at this profession as being very noble, a chance for me to do the best, to change lives of people one day at a time. And that is the biggest satisfaction I get every day from it. I mean, fortunately with Kanakji also, from the day we started our practice, the first day we started our practice, I remember his words. I said, Nilesh and Preeti, if anybody comes to your office who does not have insurance and cannot afford to take care, do me a favor, take care of them. I will pay their bills. Even today, I have so many people who've come from all over, and he will recommend them right away to me. I mean, I've had so many, he's been around, he goes to the temple, to the community. If someone approaches him with a problem, he'll call me right away and say, Nilesh, take care of him. And the next thing I do is I have an appointment for that patient ready. There's no questions asked. Do you need a referral, insurance, payment? No, nothing. I make an appointment for them because that's my responsibility, taking care of them. And I can see how when I take care of my community, all of you take care of me. Everybody has been around to support us, always.
Thank you.
Thank you.
But
this, I'm really touched. Preeti would also like to convey her good wishes to everybody. She just got home. She was with the patient who had some problems, so she almost spent 45 minutes to an hour with just one patient and one family, and that's why she's late. But these are the small things that we do on a daily basis, we don't realize, that really go a long way in affecting the community. But Bobby ji, Jyoti ji, and Indu ji, I really respect and thank you and commend you. Bina ji also, thank you so much for having this small event. I really appreciate it. Thank you.
Thank you. Thank you so much. Thank you so much. Well, moving on with our, paying tribute and paying respect to the doctors, we also have Dr. Jyotiji, you want to call Dr. Abhay Malhotra? You want to call him? Okay.
Dr. Abhay Malhotra, you all can see him. He was last year API president, and he's a very successful doctor and very humble person. And I know because he has some interest in music also. He sings also, and he's a nice family. And we congratulate you, Abhayji, for all your achievement. You reached the highest level. You were in API and you did such a nice programs for the community and for everyone. So thank you and congratulations on this special day. And we want you to say something. Tell us something.
Oh, thank you, Jyoti ji. I hope you can hear me.
Yes.
Yeah, I want to thank you, Indu ji, Bobby ji. It's always very, I feel happy when somebody appreciates us being a physician. As you all know that, physicians do have to work very hard and go through audacities of the life. But once you see appreciation from all of the friends and the leaders of the community, it really feels very happy. And as you said, I was fortunate to be the president of IALI organization, which is one of the great organizations. I think Dr. Pandya is here. He's a part of it too. Dr. Mehra, we were able to help our people back home in India by doing a COVID-19 Help India campaign back in March, April of last year when they really needed resources. And, once you make up your decision that you want to do something, the whole community, all the physicians, all of you, RPQLI members, they contributed, and we generated funds, spent close to $80,000, thanks to IALI, who also contributed for this. And it was for noble act. And as you said, the best thing is when the patients, when you get thank you letters from the families, that is the biggest achievement of your life. You know, these awards and all do matter, but that is the biggest achievement of your life. And I'm very happy today that I'm the part of other leaders involved in this Zoom. I want to thank you all for this appreciation. And, I always talk to Dr. Pandya, Dr. Shah, Dr. Nilesh Mehta. They are all doing excellent job. Congratulations to them. And thank you so much, Jyoti ji. Hopefully I'll see you soon at the karaoke and we'll sing a song together. Thank you.
Okay.
Have a good night.
Bina, you want to call?
Okay, Induji. Next, doctor, it is my pleasure to invite my best friend, Dr. Bhavani Srinivasan. Who doesn't know Dr. Bhavani Srinivasan? She's not only a doctor. Come on, Babiji. She's not only a doctor, she's a good friend of the community. She wears so many hats as a physician, as a community leader, as a social worker. I have no words for her. Everyone knows about her work. Bhavani, hats off to you for your service to the community as a physician. I really wish you all the best. To all the doctors here, congratulations and a happy National Doctors Day. It is all yours, Bhavani. Take the floor.
Can you hear me?
Yeah.
Yeah. Good evening, everyone. I want to thank Friends of Good Health, Bobby Ji. I want to thank Indian American Forum, Indu Ji, and I want to thank India Association of Long Island, Bina Ji, and Jyoti Ji for putting this event together. Yeah, I was very touched that you thought of me, and that I'm on this particular list, and just wanted to say that I wanted to be a physician from the age of 6. I would line up all my dolls, and my younger sister was my unwilling assistant. And, so I would take care of the dolls then. So, that was something that I always wanted to be a physician. And so I do pediatrics, public health, and acupuncture. And I used to be with the Suffolk County Department of Health as the medical director for children with special needs. And in that capacity, we did treat a lot of children who belong to the disadvantaged socioeconomic group and had nowhere else to go. And we really made a difference to them in their lives. Because I believe that if you can help one person a day, then that you're fortunate, to be in that position to help them. And during COVID, which did its ravages on not only here, but all around the globe. And we all did our bit, we all pitched in, and we did collect a lot of funds, not only RPQLI, as Dr. Malhotra has mentioned, National RP also collected funds to the tune of 5 million. And we were able to send that across in the form of oxygen concentrators, as well as various other forms of equipment, which were most essential and most required at that time. And my son is not a physician, but he is a PhD in genomics, and he contributed $100,000 last year to the Prime Minister's fund in India for COVID relief. Yeah, so he said, "Mom, I'm trying to do my bit, to help." So that was
nice.
Yes, that was very nice. And to all the doctors all over the world, and to my colleagues who are here in particular, happy Doctors Day to you too. And I was very pleasantly surprised and touched when I got a lot of emails and a lot of texts today, wishing me. And I said, this is a very nice gesture that people have made. And thank you all for doing this gesture this evening. And have a wonderful evening. Thanks again.
So Bhavani, very well said. And, very important that, your son, gave a very big donation. So that shows that how our children are, looking at the community service and helping others too. So that's very nice. Okay, so moving on, Bobby ji, you want to call Dr. Pandya?
Yes, I will. Good evening. I'm glad you put your video on, Dr. Pandya. Uh, as is your patient,
Handsome Dr. Pandya.
as is your patient, I demand that. As a friend, I demand that. As a humble servant to our community, I demand that. No, uh, Dr. Pandya is but I salute you. My simple word is I salute you. It's not easy to deal with me as a patient, by the way. Uh, I know I'm a difficult patient. Uh, more, I want to make that clear. Even though I said Nilesh ji is my doctor and Dr. Pandya is my doctor, I did not selected either one of them. It was Indu and Jyoti and Bina ji. I don't want to take a credit of something I should not. Only the two people I nominated was the young, this energetic Dr. Prachi Dua, and the other was my senior, and somebody yell at me more often is Dr. Bhupi Patel. Everybody else was other people's recommendation, especially when it came to Dr. Bhavani Srinivasan. So talking about Dr. Pandya, it's not because he's my doctor. They said when you know someone personally, you actually can speak about their service. Doesn't matter where I am in the world. And when people call me and they're looking for help, and I'm telling you, it is my calls to Dr. Pandya or to Nilesh or to Dr. Vijay Shah and Bhupi Patel and so many other doctors. Even yesterday, Dr. Krishna Jiveri, even though he don't practice anymore, but I bother them, I call them. If it's a Dr. Arya, I pick up the phone, I call them. One way or the other, I call at least 2, 3, 4, 5 different doctors a day because people come, they have no insurance, they need a help. Like yesterday, I cannot disclose a particular person's name because it's their privacy. Somebody who coming to perform the situation here in New York, and they didn't have the insurance, but they needed a help on the spot. I reach out to a couple of the doctors, then I reach out to our hospital. We was able to provide the help. But when come to Dr. Pandya, I'm not joking. Serious note, I call him in so many awkward times. Not a, ever, he ever disappointed me. I thank you every day, every time. Knowing you, I feel proud. But knowing the service you provide make me feel more prouder. Keep that good work uh, to serve the society. But all of you do. It's really make me so humble, make me so proud, make me so energetic. Me, look at me, 65, I'm the best looking. It's because of you guys, because of Dr. Pandya, because of Dr. Nilesh, because of Vijay Shah comes in every 3 months. He said, did your medical report? Did your blood test? It's your reminder, it's your love. I never can say enough thank you. And doctor, keep that good work. Congratulations. Thank you every day, Dr. Manju Pandya.
Thank you, Bobby Ji. Thank you for the introduction. And first of all, thank you, Jyoti Ji, for constantly calling me. And finally, I picked up the phone just to confirm that. Thank you so much. Indu Ji and Bina Ji, truly appreciated at Doctor's Day. And I told her that I have limited time, but I said that no, this is something I would definitely come up with that. I just want to share the experience we all know, but when COVID started, many of you probably are not aware of that. I was quarantined from the first week of March 2020. For 7 months from March, we actually, 3 of us, me, my wife and my son, we never went together anywhere, not just the travel. It was so difficult time for us, but when we were looking at that, I used to do 70 to 80 calls a day, 7 days a week, just during COVID time. Hospital, we had close to like 60 patients getting tired. changing gowns because each patient, we were not getting reports right away. So we had to change gowns for each and every patient. So think about the changing just 60 gowns a day. It's automatically you get tired when you come home, you have to make 50, 60 calls for all the patients. And it was very difficult period. I think the most sacrifice for all of the physicians will be agreed on that is a family. The family made the biggest sacrifice because they did not know what is the weekend, what is the time off, where to go. All they stayed home. And not just that, they supported us when we were doing something. When I had COVID, I had in the beginning, and that was in the March, end of March 2020. Luckily, with the God's grace, I did not even have to take one Tylenol, and I walked every single day 1 mile, even my COVID time. Only thing I could not eat for 11 days, and I lost almost 18 pounds. But I recovered, and there was no problem, without any problem. I think after that, when we realized there are people, they were having a hard time. For example, it's a family of 4 and one person is coming back positive, they cannot travel in one car. So this was the biggest problem. So then they used to call us. Now, some of our patients, some of not our patients, but then we decided, what should we do? If they cannot travel in one car, and then they cannot ask the neighbor because they did not know whether somebody is positive or not in family of 4. So I actually went to their houses and I did rapid and PCR test both at that time. More than probably 500 patients I went to the house, 500 families. We did that. The best thing is they did not have to come outside. We were able to get the result. When vaccine started, our urgent care, AFC urgent care, we were very proactive. And I think many of you might know that we were the actually few of them that we got the vaccine in the beginning because we had done so much paperwork. We were ready with the refrigerator and we were giving like 200 vaccines a day in January 2021 when it was just started. And a lot of people know that they came. We actually kept our urgent care open from 7 a.m. to 3 a.m. just to make sure we can actually accommodate as many as people because it was a big issue allowing more than certain amount of patients there. It was a lot of restrictions, but we kept it. When I was a president, my presidency ended in 2020 February, and the COVID started. I think Dr. Abhay Malhotra, Dr. Sunil Mehra, Dr. Srinivasan, they all know we had emergency meeting and we approved $25,000 at that time right away because there were a lot of people that they could not afford staying in the houses. And there was an issue until this rules came that they would have lost their house or probably their apartment. I think that 25,000 we reached to the families, we gave it to them, no pictures. We all decided that if we would not take any pictures, it should be very confidential, and this is what we did that. The only thing we all believe in true humanity, and we realized this was the biggest issue. Not just that, during this vaccine time, there were patients in January and February, they were waiting for the transplant surgery, like lung transplant, heart transplant, kidney transplant. So definitely they could not come to the center to get the vaccine. There are people in the wheelchair. I actually went to their houses. We made all the arrangements. So somebody went to their house to give the vaccine. That was the first vaccine started from January 2021. So many cases that they were happy. We got so many blessings with that one. And I think that's the reason probably we were able to manage it. And the last thing I would say, all of you are doing great work and all my colleagues, I know they must have gone through a lot of things also. And I know Dr. Bhupi Patel, he's my guru also. So he was the one advised me when I started my career that what to do. And he told me 3 things and I followed. And I think that's what helped me a lot. I know my colleagues, Dr. Srinivasan, Dr. Mehra, Dr. Abhay Malhotra, Dr. Nilesh Mehta, and I think all of us, we are here. But again, thank you so much for giving me an opportunity. This is not just the award, but this is what I feel today. From your heart, I feel that this is something it's going to touch to us for rest of our life. But thank you so much.
I just want to add something, Dr. Himanshu Pandya, you are great. I want to tell in front of everyone how many people you helped, through me, seniors who needed vaccine, and you helped them, gave them appointments. So I am always thankful to you for that. Thank you.
Well, moving on. Thank you, Dr. Pandya. You are our hero, one of the heroic doctors. Of course, like this, we have all worked through the pandemic and seeing patients, and all of us know what we all went through. So going back to Bobby G's, that he has a GI doctor and he has other doctors who are his doctors. But I'm also his dietitian. He doesn't say that, but that's true. Okay, now we are also joined with Dr. Sunil Gara, talking about ICU, talking about critical care, talking about pulmonary care. Sunilji, happy Doctor's Day to you. Happy National Doctor's Day to you. And we want to thank you and congratulate you and for all the compliments you do and all the hard work that you're doing. Happy Doctor's Day again.
Thank you very much.
Gara.
I joined late because I was late working today. I'm very thankful to your whole team. I think you guys have done remarkable work coming last Sunday. And all the time, I think Bobby, Dr. Patel, Dr. Zanand, you and your team, I think does something very quietly and nicely. And this was very kind of you to honor and wish us a very nice, happy Doctor's Day. The sad part is that even the New York State forgot after the heroes, and Northwell also forgot, the doctors are the one that got rid of us. But I think it was a test of patience, test of ethics, and just coming together, being thankful to God, I tell you, for saving a lot of us. And as Himanshu has done a lot of work with going, I didn't go to anybody's home. It was not safe. So, but I got sick on April 1st for till like 23 days, had fever 102. But I think it's somebody's blessings and good wishes which saved us. Because as physicians, initial couple of months, we didn't know what to do right or wrong. We just did whatever we could do. People were put on vents. After 2-3 months, we realized we should have not done that, might have saved. Second part, we realized that it was not just pneumonia, there were blood clots, but we learned a lot. And Dr. Patel, who's like my older brother, and he's the one who basically guided me during my career. I joined him immediately out of my fellowship as his partner, and I learned a few very good things about you. Give it back to community. I worked very hard with him and the other colleague for Gujarati Samaj that was opened. And I remember I was only 1 year with Dr. Patel and we raised about $150,000. It was Dr. Patel's wish, and we all worked hard for that. And during years, he has guided. We have taken a lot of tests together because he pushes me, do this, do this. And Bobby has always been like, I don't know, younger or brother, but he's a brother who is from my state. And
always younger. Just keep it that way.
Done. But I tell you that he always at least gives the support that he is with me. And so that makes a difference. I want to congratulate you all for organizing and wishing all the doctors a very happy Doctor's Day. I think it's a commitment. And I grew up this community, starting with IALI and then coming to RP, AIA. I think we are also servers, We are not the leaders because we have too many chiefs. There are only few like Indians left. All they are chiefs. So, but we are glad that I'm part of the Long Island community where we are working together towards one cause to serve the humanity and be nice. Thank you.
Congratulations, Dr. Mehra.
Yes.
Thank you.
Induji, is Dr. Nuri coming? I don't see him.
He hasn't joined. Maybe he must be busy. So, Bina, you want to?
Who is next?
Okay. I also see on the screen over here, joining us is Dr. Vijay Shah. So Dr. Shah, would you like to come in and join us? And also congratulations to you for all the good work that you have been doing all these years. Dr. Vijay Shah, please. You need to unmute.
Good evening, everyone. Thank you, friends for good health, Babiji, IAF and IALI. Thank you for in such a short notice having this wonderful show. All the doctors said that we all are very humbled that on this day, the community is appreciating the doctors. But let me tell you, it's not just the one doctor, the entire healthcare team, and Induji knows that. There are plenty of people. Technician, radiology, ultrasound, dietitian, social worker. There is an entire team responsible for well-being of one patient. So kudos to the entire healthcare team. Other thing in the COVID time, now I want to go beyond the healthcare team. We see as a human that nobody can live with one kind of a team. Everybody needs everyone. Even the simple worker like a cleaner who cleans the places, who can inadvertently help making people safe, not having disease or COVID. So that person, the simple worker who's cleaning the places, is equally important. And I thank everyone. The biggest thing I would just say as a doctor, when we start practice, probably money is there, but once we grow older, the smile on patient's face and the satisfaction in the family's eyes, that's the biggest reward. At least I see, and probably all of us see. But again, I see a lot of my friends, Dr. Bhupi Patel, Dr. Mehra, Dr. Pandya, Dr. Malhotra, Dr. Dua. And again, thank you, entire team. Thank you so much. And Dr. Pandya, of course. Thank you.
Induji, you know, it's really touched my heart to listening to all these wonderful doctors finding their times. And I heard what Himanshu Pandyaji said. As you all know, I'm not a professional of doctor, but living around all the doctors in the hospitals, nurses, staff, and others, it was very humbling. And I want you to know, in my entire life, from child labor till now, I don't think I ever worked so hard or so many hours that I started on March 19 of 2020. And you know, with God's blessing and thanks to these wonderful doctors, friends, especially my own personal doctor, Pandya, Nilesh, and Vijay and Bhupi, they kept me online. And I was doing 14 hours a day, delivering groceries, delivering masks, delivering food with my own money. But I do want to recognize Nargadas Foundation and Deepak Bansal. They had helped me to provide, and Patel Brothers, because I didn't want to pick up the food from Rajbhog for $50 and want to take 200 pictures and tell the whole world we're doing a service. And I want you to know we didn't stop. Last week alone, we just delivered to our hospital 35 pallets of alcohol pipes, masks, and other stuff related to the COVID or related to the hospital. We do not stop. We continue because the disease, the fight didn't end yet. It is still there. And we should continue to be vigilant, should be aware of it. We should not take this for granted. We shouldn't just run out. I'm sure the doctor should have told instead of me telling that thank God, like Dr. Himanshu said, even though he's a doctor, The COVID didn't care what you are in a profession, what you look like, what your religion is. She got you. And thank God, thank God, thank God, with all this, I'm going to say thank you, Lord, myself and my entire family. Even though I was living through every day with COVID patients and COVID families, dropping the masks in their houses, dropping the foods. So I'm not going to jinx myself. All I can say is it did not touch any member of my family or me. It is because I listened to the advice of all you professionals. I follow the rules I could, and it was not that easy. It was tough. But let's not take this for granted, and please continue. Thank these doctors not only just today, but every day, their sacrifice, their work. And I wanted to recognize that again. Thank you allowing me and given me the opportunity to join and say thank you to these really distinguished doctors. They make us proud. They really do. I feel every day. You could be the governor, you could be the president of the country. But when they tell you, my doctor is a Patel, my doctor is a Shah, my doctor is a Karkre, my doctor is so and so, it makes you feel good. It really makes you feel good if somebody top and cream of the world, if it's a king or a queen, and they say, my doctor is so and so. The guy could have become the speaker, Joe Crowley, and he used to brag about Dr. Bhupi Patel. You know who my doctor is? I say, no, I don't. Can you tell me? That's a Dr. Bhupi Patel. So what you guys do, I want you to know, it really humbled me. Those people appreciate your services more than you know. Sometimes you might think, does somebody really care? Do they only think that I'm doing my profession, I'm making my money, and so what? I had to say, including myself, no, that's not true. Everybody had to make a living, but people do appreciate your noble service, the noble profession you choose. Thank you again.
Thank you, Bobby ji. Jyoti ji, is Sean there?
Dr. Shan Gupta, he's my son. He's still working in Mount Sinai. He's not home yet. Sorry, lots of work. So
do you see any other physician whom we need to on the screen, or we invite?
I think what we assign, everybody said, spoke, and I don't see any more. Yeah.
Okay, I think we are coming towards the end of the program. If anybody else would like to say a few words before we wind up.
No, before concluding, we should honor Bobby ji for his service. I have seen Bobby ji during this COVID time, how he was working with people, going to the hospital every day and night. I was really surprised. He's not a doctor, but he's better than any other doctor because of his service. Definitely, Bobby ji, you deserve this big honor today. Happy Doctor.
He's a good human being.
I just want to say something about Bobby ji. There's 4 lines in Hindi. Na koi dard, na koi aram. Bas jindagi is community ke naam. That's what Bobby ji is.
Yes, you said it right, Jyoti. You said it right.
I want to give shout out to, I'm looking at Vimal Goyal ji. He's helpful. Whenever we ask, he's always there. And Kanak Golia ji, I take it for a granted. Each time I see him, I say, that's my bank. Kanak Golia is my bank in a love, in a friendship. Not only money-wise, I don't bother him that often, but when you talk about brothers and friends, they are always there. And Pradeep Tandonji, and I had to say to all the doctors, I'm sorry if I bothered you all those phone calls, but my heart so proudly reach out to you to serve the community. Really. It really humbled you, but it's your service, what you do every day. And Prachi, you better be ready. We're going to put you on our board. We are going on the next mission. 7 days. Ask Dr. Bhupi Patel. You land on the airport, 500 patients right there. Next
straight.
morning, 700. Next morning, we did 7,000 patient in 6 days,
Yeah.
right? Or 7 days?
My
You
goodness.
know,
Prachi is our younger,
yeah.
going to make us all proud. Prachi is
No,
very
when we went to
sincere,
Salvador Prachi, we were
very
in the
good
bus
ophthalmologist.
and they told us to stop over for a lunch. And from there, where do we go? We go straight to mayor's office. Line of patients over there. We didn't even know where we were going to stay. I said, where are we going to stay? Don't worry, see the patients first. So that's what happens at a camp. So Vimalji, would you like to say a few words before we wrap up? Vimalji, can you hear
Vimal
us?
Goel. Vimal Goel ji.
Oh, I'm
He's
sorry.
asking you. You know, this is
Oh,
what
I'm
happened.
sorry.
When people make money, they go to sleep,
I
even
know,
while they're
right? I was
awake.
counting money, so what can I
Yeah,
do?
that's what the problem is.
For the
Vimal ji,
group?
we love you and say a few words.
He was counting money.
Yeah, well, yeah, Induji, thank you. Listen, everyone, I'm glad to see all the familiar faces, and it's amazing that we are here to thank our nation, I mean, Indian physicians who have put their lives on the line, and it's a great thing to do. And you know what Dr. Mehta was saying before, see, and maybe another doctor was also saying, see, the thing is, it's not only the physicians. We need to honor everyone else who is putting themselves on the line, and all the frontline workers in the medical profession. They are risking their lives every day. Cleaners, nurses, assistant nurses, and there's so many technicians, X-ray technicians, ultrasound technician. My own wife, actually, she does echocardiograms, and every day I see, whenever she comes home, I'm worried about her. So I think this is what makes everyone proud of having all these workers in the front line. And look, we never thought this before pandemic that our own people were going to be at risk, putting their own line at risk. But this is what we learned from this pandemic. Thank you very much.
I just wanted you to know, it's not that we are not recognizing the other people. We do. Just we have a Women's Day another day. Today is all about doctors. So we want to absolutely dedicate this time, this day for Happy Doctors Day. Thank you, Doctors Day. Appreciated Doctors Day. Whatever you want to call it. And those friends that we lost from this profession,
Oh, yeah.
who was a great servant, great doctors, including Dr. Arvind Shah and Dr. Ajay Lodha.
Yes.
And please have them and their families in your prayers, because not by just because they are doctor, it's just because they're our family.
Yes,
Thank you so much.
definitely,
God
yes.
bless and congratulations again.
Prachi, would you like to say some closing remarks?
No, I agree with everyone. I don't think that a doctor's job can be done without the help of everybody. And I think that even till today, like I always wish all my staff and the secretaries, like when I walk in, like good morning, and I thank everybody at the end of the day for helping me get through like 40 to 50 patients, because I wouldn't be able to do it without them. It's a team effort to take care of patients.
Right.
Thank you.
Thank you.
So Jyotiji, I think
Kanak Golia ji, your word is the last word. Kanak Golia ji, so go ahead. Everybody getting a perfume tomorrow. Just kidding.
But
Your word is the last word, brother.
Yeah, today is the day of doctors. So I'm the proud father of doctors. I'm the proud uncle of doctors. I have like 21 doctors in my family. So I can see them very closely, how they serve the community in good time and bad time and tough time. So I really salute them, and I always pray for them that they keep them healthy and they can continue to serve the community. Thank you.
Thank you. Well, on that note, I think we were supposed to be from 8 to 9. So we are doing overtime now, right, Jyotiji? So would you like to close this program, Jyotiji?
Yes, I'm so happy that we organized this program. It was Bobby ji and Indu ji's idea. I got in the morning call and then we organized, and I'm so happy that we thank all the doctors and They spoke so well, and we learned so much from them, from their experience. And everybody did so good job in COVID time. And I'm touched with their all the work they have done so far. Everyone, you deserve round of applause. All the doctors.
Jyotiji, it won't be fair if I don't say thank you to your husband helping out Govind Gupta ji, as well as Anmol from the printing, the one who preparing the plaques for everybody. And because this whole thing, I just want doctors to know, started I think around 11:30
Yeah,
today.
I was talking to Bobby.
So everybody who chip in and join in, I want to say thank you. God bless. Have a good night.
Good
Thank you. Good night. Good night.